doctor on television used a defibrillator on a patient whose heart monitor showed a flat line. It is one of the most familiar scenes in medical dramas. The doctor delivers a shock, and moments later, the patient comes back to life. It is dramatic and memorable. However, in real medicine, a defibrillator cannot restore a completely flat heart. Many of us regularly watch medical dramas through television or streaming platforms because these programs are entertaining and emotionally engaging. Viewers may unknowingly absorb the medical information they present. Hello everyone, my name is Li Zhuohan, and today I will discuss the problem of inaccurate medical portrayals, the effect these portrayals have on audience, and why legal regulation offers a necessary solution. So for now, let's begin with the problem. Medical dramas often sacrifice accuracy to increase treatment value. According to a 2024 study by Zago and his teammates, medical dramas significantly overrepresent emergency situations, so trauma cases and life-threatening conditions compared to actual hospitalization patterns. While these cases attract viewers, they do not accurately reflect what happens in most healthcare settings. Medical producers are also frequently portrayed inaccurately. Zago and his teammates found that CPR success rates in medical dramas are often present as much higher than those observed in real clinical practice. Patients frequently recover within minutes, and basic hygiene procedures are often ignored. These portrayals create a misleading picture of how medicine actually works. This inaccuracy may seem harmless, but they can have important effect. One major effect is the development of unrealistic perception of diseases and treatment outcomes. According to Hoffman and his teammates' 2022 study, repeated exposure to medical narratives can influence how audience perceive illnesses. Frequent viewers may develop the inaccurate beliefs about diseases and may even overestimate mortality rates for conditions such as cancer. Medical dramas can also create unrealistic explanation of healthcare systems. On television, patients often receive immediate diagnosis and rapid treatment. But in reality, healthcare systems operate under limited resources, waiting times, and complex procedures. When real explanation fail to match television portrayals, frustration and disappointment often follow. This effect can be even more serious for people with lower level of health literacy. Research conducted by Suzy and Nakamoto in 2024 found that individuals with limited health knowledge often struggle to evaluate the accuracy for health information. As a result, they are more likely to accept inaccurate portrayals as factual information. So given this consequence, legal regulation becomes an important solution. According to Rocha and his teammates in 2021, health misinformation can spread rapidly through media and significantly influence public perception of health issues. Because medical dramas reach larger audiences through emotionally engaging stories, inaccurate medical content can become highly persuasive. One way to address this problem is through professional oversight. Television producers could be required to consult qualified medical experts during script development and production. This would help ensure that medical producers and healthcare practice are portrayed more accurately. Regulatory guidelines could also encourage responsible portrayals of medicine while still allowing creative storytelling. Brief disclaimer could remind viewers that medical dramas are designed for treatment and should not replace professional medical advice. Nascimento and his teammates suggested that accurate health communication can improve public understanding and support better health literacy. Medical dramas can remain engaging while also providing information that is responsible and truthworthy. Having considered the problem, its effect, and their solutions, we can now return to the central question of today's speech. In conclusion, medical dramas should be legally regulated because inaccurate portrayals of medicine can distort public understanding, create unrealistic explanation of healthcare, and weaken public health literacy. This evidence presented today demonstrates that medical dramas do more than entertain. They influence how people think about diseases, treatment, and healthcare system. So, when you see a television doctor shock a flatline patient back to life, remember this. Dramatic intertreatment may create compelling stories, but it should never be mistaken for medical truth.